I know it's because of my position in the system that I have the opportunity to be here tonight. But tonight I'm here as a son, a brother, a husband, a father, and a grandfather. Tonight I want to share 3 personal experiences. Tonight I have 3 hopes for a better future for my children and granddaughter. Tonight I also have 3 challenges for you. My dad was born in Northern Ireland and served in the British Army during World War II. He came to Canada in the 50s to teach high school. He met my mother, also a teacher, in Prince George, where I was born, the first of their 5 children. We grew up in Kamloops, where Dad was a vice principal who loved woodworking in his 800-square-foot workshop. As is typical, I did not fully appreciate all the support from my parents until I had my 3 daughters and learned what busy was. My dad watched every hockey game I ever played on early mornings in dark, cold arenas. He coached every one of my youth soccer games. Growing up, my dad was my hero. He still is today. In 1996, at age 78, a shadow was found on my dad's chest x-ray. Without being asked, I took charge in ensuring my dad got the most aggressive care the system could deliver. He had a portion of a lung removed. It was renal cancer, and a mass was found in his kidney. I pushed harder and convinced a surgeon to remove the kidney. Through this journey with my parents, we experienced a myriad of system gaps, lack of clear plans, arriving at specialist appointments where they had no idea why we were there, repeating information over and over and over. I started getting copies of all charts and reports and created my own chart, which we took to every visit. Before the kidney procedure, my dad had a CT scan to check for other lesions. His surgeon called me at work, abruptly told me there were more lesions, surgery was canceled, and I was to tell my dad he was terminal. I left work and feeling overwhelming sadness, I drove from White Rock to Kamloops for the hardest conversation of my life. My dad had a goal to build a grandfather clock for each of his kids. By this time, 4 were complete and 1 was left. My brother Darcy inherited my dad's hands. Visiting Dad the summer before he died, I found Darcy in the shop with Dad. Darcy was patiently following my dad's directions to complete the last clock. Darcy could have quickly and easily finished that clock himself, but he followed Dad's detailed directions, working when Dad could and stopping when Dad needed to rest. He became my father's hands and fulfilled my father's dream to handcraft a clock for each of his children. My brother Kevin has that last clock. In 1998, driving to Prince George, I stopped in Kamloops. My mom and brother Kevin left me alone with Dad for a few minutes. Dad whispered to me that he was tired and asked me to tell my mom that he couldn't hold on any longer. My final gift was to do what he asked. I continued my trip and got the news of his passing the next morning. In healthcare, with all good intentions, we can do to people, we can do for them, or we can do with them. In taking charge when Dad was ill and not asking what he wanted, I was doing to him. I assumed I knew what he wanted. It took my brother, the electrician, to show me what it meant to do with. Darcy exemplified a person-centered approach. My first hope is that the healthcare system and all physicians and staff can become truly person and family-centered, that we learn to always do with the people we serve, not for them and not to them, that we stop assuming that we know what is needed out of caring, but truly ask the person before us what they want and need. This is my middle daughter, Brianne. All my girls were active, but Brianne was exceptional. She couldn't sit still. She was always laughing and smiling. She loved touching and exploring everything. Her nickname was Little Fingers. Somewhere in high school, that carefree outlook slowly changed, but I think we were too busy to really notice. In 2011, I was in New Zealand, taking Brianne back for her 2nd year at the University of Auckland. We were surrounded by excited kids on campus, and I remember looking at her and thinking something was so wrong. She looked so sad and out of place. Instead of buying books for the semester, we went straight to student health services. Within an hour, she had seen several professionals in an amazing integrated clinic. Quickly, a diagnosis of depression was made. Plans changed, and we flew home. Back in Canada, she received care, but again, it was hard to see the plan and easy to see the gaps. Today, she is at Brock University and the president of their Active Minds chapter, sharing her story to help others. In 2010, self-harm killed more people in the developed world than war, murder, and natural disasters combined. My second hope is that our system and society will tackle the issue of mental illness, that we will eliminate the stigma and get down to work to find answers and provide care to those who desperately need our help. My first challenge to you is about caring. People who feel cared for care for others. Today on Pink Shirt Day, I challenge you to go back to your organizations and create that caring environment. I also challenge you to look differently at people with mental illness, to look deeper, to see a son, a daughter, a person. I challenge us to extend a hand. My oldest daughter, Sarah, is a teacher. She taught for 2 years on a First Nations reserve in northern Alberta. She shared with us all the challenges. It wasn't safe to drink the water. The days the school was closed because there was no water. The days it was closed to be used for a funeral. The children who came to school hungry. The children who rarely came to school. She shared heartbreaking stories of kids who wanted to learn but who were not supported. Tragic stories of daily challenges of life in the village. She made the stories we see in the news personal. I am proud of Canada for our international aid efforts, and they need to continue. I am ashamed that we let children live in poverty anywhere in our wealthy country. As a system and society, we talk about upstream solutions, focused efforts on preventing disease and improving health, efforts to address the social determinants of health. My third hope tonight is that we stop talking and start acting. There are children in this country who live in appalling conditions. That situation is unacceptable. We need to act to change it. My third challenge is to ask you to advocate for change in how we care for children in this country. Look around you. We are all so fortunate. Canada has many challenges, but also much wealth. If we don't address racism, poverty, and access to effective education, we are failing as a society and as individuals. Thank you.